people will come in and they'll say, my doctor sent me, or I came in because I have hip pain. And one of the first things I'll say is, can you please point to where it hurts? And people will typically say, my hip hurts. And they point right here. And you're like, okay, can you be a little bit more specific? Is it like more to the side or more to the back? And they'll point back here at their buttock. And then that immediately prefaces my next question, which is, do you have groin pain? And they'll say, what? I go, can you please point to your groin? And they go, right here. Do you have pain there? And they say, no, I don't, but my hip hurts. So most people think their hip is back here, but in fact your hip is right here. It's literally right in your groin. So if someone says, my hip hurts, and they point here, then I know, yeah, that's really hip pain. And then I'll ask, part of my questionnaire I ask most of my patients, can you cut your toenails? No, I can't. I can on my left foot, but I can't on my right. And I can't put my sock on. I need help putting my socks on. So that's a very typical symptom of osteoarthritis or a problem in the hip.
Hips, interestingly enough, are, in my mind, easier because it's a faster development of symptoms, and then usually they'll come in and you can see that it's worn out and probably has to do with the nerve innervating the hip. The hip is probably a quieter joint than the knees. I think that may explain why hip replacement patients do so well.